Thank you, and thank you very much for having me this evening. I'm very privileged to be here. So what I'm doing this evening is I'm just sharing our continuity journey at Rotherham, and this was a presentation that we shared with the NHS England team when they came to visit us at Rotherham in August for their assurance visit. So we were very proud to share our journey. So just to give you a little bit of background about Rotherham. So for those of you that don't know Rotherham, it's a town. It's north of Sheffield and it's an industrial town. We sort of say that Rotherham is sort of squashed between Sheffield, Doncaster, Bassetlaw and Barnsley. So it's a district general hospital that we have in England. We book around 3,000 women a year. And we birth, our births, as nationally, there's been a trend in births going down, in decreasing our births to around 2,500. So, yeah, we have around 112 whole-time equivalent midwives that work at Rotherham. And we are very proud of our journey with continuity so far, particularly during the pandemic, because we've managed to maintain continuity during the pandemic. So just to give you a little overview, we have got 3 teams now for continuity. In March, so we started our journey in March 2019, and you will see that there is a tree theme for all our continuity teams. So the first team was Willow, and this was launched in March 2019. And there are 8 whole-time equivalent midwives that work in that team, and that was a geographical and low-risk team. And following the success of Willow team in November 2019, the Poplar team was launched, and we got all staff out into the team by just before the pandemic really hit in January 2020. And again, we worked with 8 whole-time equivalent midwives, a geographical and mixed risk model. And these midwives chose to work night duty for their on-calls. In May 2020, so this was just before I arrived at Rotherham as the head of midwifery, we continued with the drive and the plan to implement a 3rd team. So the Maple team was launched, and we got all staff. We got the team launched in July 2020 and went again for the same model with a head count of 8 midwives working in the team. And this team decided to do a mixture of nights and on-call. So they were doing a little bit of a mix. And again, it was geographically based and a mixed risk model. The data here is the figure that we had presented, which we present each month to the local maternity system in South Yorkshire and Bassetlaw. And this shows our performance for achieving continuity of care. So where women who are on the pathway, where we've met all the criteria, so all our markers and all our KPIs for women who are on the continuity of care pathways. So you will see there that along with Barnsley, we have really achieved really well and done really highly with that. I think it's fair to say that we know that some of our other partners and colleagues have been challenged in the LMS due to staffing and the national sort of issues that we have had in maternity services. So that just highlights where we are with our performance. And here's just a little bit more performance data for you, but just to highlight that since October 2020, we achieved what was then the NHS England target of achieving over 35% of women on a continuity of care pathway. And our next sort of ambition is to ensure that, as you know, following all the guidance from COVID, from Embrace, you know, and from NHS England regarding ensuring that we were getting the coverage of the most vulnerable women. And that was following the Embrace reports and the COVID reports that were coming out during the pandemic. So we've since been working really, really hard to achieve that coverage in the right geographical areas for the deprivation index. So that has meant that we're looking at, and we've started reconfiguring our teams to get the deprivation and BAME coverage. So you'll see on that slide that we are getting there with that. And for BAME, we're looking at a range between 14 to 27%. And for the deprivation index, we're covering between 26 and 39%. You'll also see there that our intrapartum data, so that's the data for caring for women in labour for each team. So the initials represent the team. So you will see that for Willow, we're achieving 87%. For Poplar, it's 85%. And for Maple is 66%. I think it's fair to say that the Maple team have been the team that have really had a big challenge being launched through a pandemic. However, they have really, really worked hard, you know, to achieve the outcomes and maintain safe care for women. So we regularly receive feedback. We ask our maternity voice partnerships, so they're our user groups, for feedback on how continuity feels for the women. And you'll see that we've got a range of feedback here that women have shared with us about their experience of being cared for on a continuity of care pathway. So I'll just read those out to you if you cannot read them on the slide, but they felt that they'd received better care given by the Willow team than the first pregnancy, and they were able to build a relationship with their midwife. Being cared for by the Poplar team was great. I wouldn't have wanted it any other way. I had one midwife pretty much for every appointment, and then she was able to birth my baby as well. It made me feel at ease as I knew her and trusted her, and she knew all about my pregnancy and any issues that arose. As this was my first pregnancy, I had no expectations. However, the Maple team were amazing, naming the midwives, Rebecca and Natalie in particular. So I mean, that's just a very, very brief snapshot of feedback and how it feels for women. But I think we know that the evidence strongly supports that maternal satisfaction is very, very high with the continuity of care pathways. We also survey our staff, our midwives, very regularly at touch points to see how they are with the continuity of care model. And I think it's really, really fair to say that we've had the most challenging time in the last 2 years with the pandemic. And we do see that although we have maintained continuity and we have certainly achieved what we need to be achieving, there has been, our staff do you know, suffer from some element of burnout at some point, and we are sort of getting that when we sort of hit that 2-year point. So that is something that has been really impacted by the pandemic, because obviously we know nationally that staffing has been an issue, and even though as an organisation, we are over-established for midwives and we are not under-established, but the gaps that we've had with sickness, COVID absence, maternity leave, you know, it has been a challenge. So, you know, we have maintained this, but it has been more challenging due to the pandemic than we would have anticipated. So there is quite a bit of work that we're currently doing with the team to support us through that at the moment, and we're really grateful to the LMS to be supporting some work that we're going to be doing with Barnsley. So Sue mentioned the book, the Nurturing the Midwifery Staff, Maternity Staff book, and we're very privileged that we've managed to work with Jan to provide some psychological support for the teams across South Yorkshire and Basset Law to support us moving forward with that pressure. And there has been some lack of interest in joining the continuity teams because staff do want to continue with the traditional model of maternity services. And we know that, you know, this will be the default model. So it's how we attract staff now to work into continuity of care teams, and what we need, the work we need to do to attract staff to work in these new models. So that is around offering flexibility, you know, making sure that we're offering new starters. They start going out into the continuity teams at the start of their midwifery career. So we have a really good preceptorship and support package to provide the support and nurture our staff. So I'm not going to play this because it is very, very brief, but one of the big achievements we've had at Rotherham with continuity of carer is the fact that very small numbers, but it's significant for us. We have trebled our home birth rate in the 2 years that we've had continuity of carer. So in 2018, we had 28 women who booked for home births, and very sadly, only 12 received a home birth. However, in 2020, we'd seen the interest in home birth increase to 77 women, and 48 women received a home birth. So for us, that's a really, really big achievement. And this, I came into work one morning and was told that we were on our national sort of news, Good Morning Britain. So this was a snapshot that was shared with me and sent to me. Very brief, but sharing our success with our home birth rate. So just to go through now really what our plans are to achieve continuity of carer as the default model, because this is something that we're all committed to, and we know that it really does improve outcomes for women, and it can actually improve job satisfaction for midwives as well if we get the life-work balance right, and that's really, really important that we do that. So the work that we're currently doing is we're reconfiguring our 3 existing teams. So what we're looking at are postcodes now and making sure we're really getting that coverage of the deprivation index and the BAME communities locally. We're also working on our plan and starting to roll out a hub-based model. So we're going to be having bases across Rotherham. This is really, really crucial to our postcode model of working, because that means that community midwives will no longer be tied to GP surgeries, and they can work in community hubs and bases, which was one of the big ambitions of the Better Births. We're using our continuity of care modelling tool, so that's the national tool, and obviously Birth Rate Plus, to really look at how many teams we need to make it the default model. Using that modelling, we're estimating that we're going to need another 5 teams, so 8 teams in total, retaining a core staff within the hospital to provide the labour ward and the postnatal care and the care and antenatal services. And we're also looking at staff to be deployed into continuity of care teams for women who choose to birth in other neighbouring hospitals, and looking at enhanced model of care for those women who are on high risk pathways as well. So that's something that we're also planning. So we're just planning now our launch, the launch of a 4th team, and to get the right people and the right staff interested in the team, and to really make sure we've got full engagement. We're just re-energising an improvement sort of group, so that we've got all sort of stakeholders involved in the launch of the 4th team. So that's going to include labour ward coordinators, acute midwives, midwives in greenouts, doctors, support workers. So we really want to re-energise the interest in continuity, so that we can get some real good interest in the launch of the 4th team. And we're looking at our remaining teams, as we've said, to be placed across Rotherham to make sure that we've got the coverage that's required for deprivation, improving outcomes for those women from deprived communities and BAME backgrounds. Okay, thank you.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.